everyone. I am Aristide Mounchili Njifon, a student at Centre Pasteur of Cameroon. Today, I am going to present our work which titled Identification of Amino acid substitution in the Hepatitis C virus core region associated with the development of Hepatocellular Carcinoma in treatment of naive patients in Cameroon. Viral hepatitis is an inflammation of the liver caused by various viruses. According to the Organization World 2025, globally, 50 million people suffer from chronic hepatitis C virus infection, with approximately 1 million new infections occur each year. The WHO estimate that in 2022, approximately people died from hepatitis C, primarily from cirrhosis and hepatocellular carcinoma. The HCV has 8 genotypes with over 100 subtypes in Cameroon. Studies on molecular phylogeny have reported the circulation of 3 genotypes, genotype 1, genotype 2, and genotype 4. Several studies around the world have already shown that certain amino acid mutations, such as R17 and L91 in the core region of HCV, are associated with an increased risk of HCC. Cameroon is heavily affected by the HCV, with a high risk of hepatocellular carcinoma persisting even after treatment with direct-acting antivirus. There are 5 studies on core gene mutation in Central Africa. We conducted a retrospective cross-sectional study on plasma sample from HCV positive Centre Pasteur of Cameroon patients by amplifying the core region and the sequencing by Sanger. Objective aims, our study aims to identify amino acid substitution in the HCV core region associated with HCC in the treatment of naive patients. I'm sorry. We conducted a retrospective cross-sectional study on plasma sample from HCV positive Centre Pasteur of Cameroon patients by amplifying the core region and then sequencing by Sanger. After sample reception, we proceeded with RNA extraction, PCR, Sanger sequencing of the protein, and data was analyzed using the following software. Result and discussion. Was our study population consisted of 60.80% women and 39.20% men, with an average age of 68, confirming the hypothesis that HCV is more prevalent among older people. Phylogenetic analysis performed of the sequence obtained reported the co-circulation of genotype 4, 2, and genotype 1, reinforcing the hypothesis of previous studies that reported the circulation of these 3 genotypes in Cameroon, and genotype 4 dominant with subtype for F. We identify K mutation, K10R, R70, cure, T72E, K74R, G77A, and CL91M, increase the risk of development of HCC. Conclusion. Our study is the first comprehensive mapping of HCV core mutation in Central Africa. Mutation in the HCV core gene are common in Cameroon and may play a key role in the development of HCC in genotype 4 and particularly subtype 4F. These results support the elimination of HCV by 2030 via mutation screening. The study was funded by the Centre Pasteur of Cameroon, and I would also like to thank all the co-authors who participated in this study. Thank you very much. Thank you.